Hey everybody, Tribe Nursing here. Today we're going to be continuing the GI series. Today we're specifically talking about cirrhosis of the liver. I'm going to be covering the pathophysiology behind it, the nursing interventions, some diagnostics, and some medical treatments that are involved with cirrhosis. If you like this video, make sure to subscribe and give it a like, and maybe even share it to your friends. Also, something that I am doing new is that I am adding this handmade study sheets, and I placed it on Etsy.com. You have the choice to follow my lectures with my handmade notes. I'll keep a link in the description where you can find it. But with that being said, let's get started. Before we dive into cirrhosis, I think it's very important to understand what the function of the liver is. So the liver has so many functions. It is that one organ in the body that has many roles, and it's extremely important for it to be working at a 100% level. So I'm going to go ahead and break down the functions of the liver. It's important to note that the liver is one of the largest organs in the body that contains 4 main lobes. And over here is where I drew an illustration explaining the different types of lobes. We have the right lobe, which is considered to be the bigger half of the liver. We also have the left lobe over here. And then we also have the quadrate lobe. The quadrate lobe is on the posterior side, so it's going to be behind these 2 lobes. So what you're looking at is an anterior view. So the quadrate lobe would be in the back of the liver. Now we also have the caudate lobe, which is also considered to be on the posterior side. So we have 4 main lobes that the liver contains. So one of the functions of the liver is to eliminate toxins and waste. So this is extremely important for patients who are alcoholics and drink an enormous amount of alcohol. What the liver is going to do is that it's going to eliminate those toxins and waste by filtering it out within the liver. So the next function of the liver is that it produces clotting factors. Specifically, it's going to produce vitamin K dependent factors such as factor 5 and factor 8. The 4th function of the liver is that it's going to help metabolize fats, proteins, and carbohydrates. Typically in the United States, a lot of patients take in fatty foods. So if the liver is not functioning at 100%, it's not going to be able to metabolize those fats and proteins and carbohydrates, therefore causing other major issues. Also, the liver has the function of helping producing bile. Specifically what it does, it transfers that bile to the common bile duct, and it's stored in the gallbladder. So another function of the liver is blood detoxification. Going back to talk about the patient who is an alcoholic, if the liver is not performing at 100%, it's not going to be able to detoxify that blood. Therefore, it's going to be very difficult for the body to remove those alcohol compounds, and thus creating issues such as cirrhosis that can lead to necrosis, and the liver will be affected. So what is cirrhosis of the liver? Cirrhosis is slow, chronic, progressive, fibrotic liver disease. So let me go ahead and explain. Fibrotic is hardening of the liver, and what that is that it's thickening of scar tissue due to regenerating from damage of chronic either viral infection or taking in too much alcohol. So that brings me to what is cirrhosis caused by? Hepatitis B, and it's also caused by hepatitis C. Another reason why cirrhosis could occur is due to alcohol. A lot of alcoholics that drink 4 times a day, 4 times plus a day for a long period of time will result in cirrhosis of the liver due to damaging of that liver and scar tissue forming, leading to fibrotic disease. So this is an illustration I drew. For example, if a person who drinks too much alcohol for a chronic period of time, when it affects the liver, what happens is that liver is going to cause scarring and damage. And the reason that is an issue is because it cannot be reversed. So what happens is that it leads to fibrotic tissue. Every cell in our body that takes in damage will regenerate over time. But when it's chronic over years, it will cause major issues to occur. Your body gets to the point where it cannot keep up with that damaging of the liver. And what happens is that this fibrotic protein keeps on building up and building up, leading to that scar tissue. And this is known as cirrhosis. And what happens later on is that when the liver becomes scarred and damaged due to a chronic amount of alcohol consumption or just from hepatitis B and C, is that blood flow decreases within the liver, resulting in necrotic tissue. All the functions that I've listed earlier, so the liver will not be able to perform any of those functions. So for example, if the liver cannot produce clotting factors, a patient has a higher chance of bleeding. If the liver cannot metabolize fats and carbohydrates, your body will not be able to convert fats to energy, therefore increasing harmful lipids within your body, leading to a disorder known as Tay-Sachs disease. Okay, so for the signs and symptoms of cirrhosis of the liver, there are a lot of signs and symptoms because the liver has a lot of functions. Here I listed all the signs and symptoms so we can go through it together. Dyspepsia, pruritus, weight loss, bleeding and bruising, spider angiomas, jaundice, ascites, stool that's clay colored, asterisk, and palpable large liver. So I'm going to go ahead and explain how each one of these occur, but I think it's important for you to remember all the signs and symptoms. So I made a mnemonic. This is a interesting mnemonic, so stay with me. The mnemonic goes: drunks pee when binging, stop, J-sap. Okay, the ASAP. So A, as soon as possible. And I put the J in front of it. So J-sap. Drunks pee when binging, stop, J-sap. I'm gonna go ahead and explain it. So the D in drunks stands for dyspepsia. The P in P stands for pruritus. The W in when stands for weight loss. The B in binging stands for bleeding and bruising. The S in stop stands for spider angioma. The J in JSAP stands for jaundice. The A, as, stands for ascites. The S in soon stands for stool color change. A in as stands for asterisk. And P in possible stands for palpable liver. This is a mnemonic that I created on my own, and it's helped me remember all the signs and symptoms of cirrhosis. Okay, so breaking down the signs and symptoms. So for dyspepsia, why would a patient get dyspepsia? Well, it's because the patient is going to have an upset stomach related to acid, but it's not going to be related to GERD, where the acid is moving up through their esophagus. Second sign and symptom is pruritus. So pruritus, what it is itching of the skin. It's due to the increased amount of bile salts that are depositing on the skin. So a patient with cirrhosis is going to be very irritable, just scratching all over the place. It's very uncomfortable for them. Weight loss. Weight loss occurs because one of the functions of the liver is to metabolize fats and carbohydrates. So that function is no longer going to work. Therefore, the patient is going to appear skinnier. They're going to lose a lot of weight. The fourth sign and symptom is bleeding and bruising. So why does that occur? Is because another function of the liver is that it produces clotting factors, but if the liver is necrosed and it's scarred and it's just not working right, the amount of clotting factors are going to decrease significantly. Something to keep in mind is that a patient should not do strenuous activities, because if they do, they can fall and bleed. Also, we want to decrease the amount of needle sticks because the liver cannot produce those clotting factors. Therefore, a patient is going to have a higher chance of bleeding. So what is a spider angioma? So what it is, it's like these spider veins that appear on the nose. Typically, alcoholics get it the most. It's going to appear inflamed. The reason jaundice occurs is because there's an increased amount of bilirubin level. You want to look out for yellowing of the sclera, yellowing of the skin. Look in their oral mucosa with a pen light and check if there's yellowing in there. Ascites is due to decreased amount of albumin that leading to fluid loss. I'm going to break this down too because I think it's very interesting. Clay color stool, their stool color is going to change. The ninth sign of symptom is asterisk. Asterisk occurs, or tremoring occurs, due to the increased amount of ammonia. Ammonia is a byproduct of protein metabolism. So what that's going to do, ammonia is going to increase in the blood. So now what the issue is with cirrhosis is that the liver can't get rid of that excess ammonia. Ammonia is converted to urea, and the kidneys is what gets rid of urea. So what's going to happen is that since ammonia levels are increased, it's going to be extremely toxic to nerves, therefore increasing the amount of tremors. So that's why asterisks occur. A patient is going to have a palpable liver. This is also known as hepatomegaly. So typically, you should not be able to palpate a liver. In this case, the liver is enlarged due to cirrhosis. You should be able to palpate it. This is the basic functioning unit of the liver, just to have a basic idea of what's going on why ascites occurs. So we have our hepatocytes here. We have a space called the parasinoidal space within the middle. Here's our portal vein over here, and here's our hepatic artery leading into the central vein. So what happens is that with constant damage to the liver within the portal vein, it's going to increase pressure, and all that fluid that's within that space is going to leak out and enter the third space into the peritoneum, which leads to ascites. This is due to increased portal hypertension. So due to that increased pressure, fluid is going to leak out. So now that we have ascites within our peritoneum, so one of the liver's function is to produce albumin, and since the liver cannot produce that protein, we're going to see a decreased amount of albumin. That's also known as hypoalbuminemia. So what does albumin do? It has a function of osmotic pull, or also known as oncotic pressure. So what it does, it pulls out fluid from a cell. After the patient goes down and gets a paracentesis, typically they usually give a concentrated amount of albumin just to replace that amount of protein that the liver cannot make. So it's just to help regulate and keep the liver functioning as much as possible. Okay, so for some diagnostics for cirrhosis of the liver, we want to trend their AST, ALT levels. In this case, if a patient does have cirrhosis, it's going to be greater than 20. So it's important to trend those because that's specific to the liver. Second, we want to monitor their bilirubin levels because the liver is going to have a difficult time conjugating that bilirubin, and the amount is going to increase significantly. Also, we want to monitor their ammonia because that ammonia is going to lead to their asterisks and their tremors. So it can be above a number of 56. So we can also diagnose cirrhosis with an abdominal x-ray. There we're going to see hepatomegaly, we're going to see an enlarged liver. One of the best ways to diagnose cirrhosis of the liver is with a liver biopsy. What that's going to do is it's going to reveal hepatic tissue damage and fibrosis. So some treatment styles, we want to treat the cause. So what is the reason why the liver is not functioning? So we want to refer them to counseling. It's for alcoholics. A physician may place them on a certain medication to prevent them from drinking alcohol. If the patient already has cirrhosis, they may need a paracentesis due to the amount of ascites that I explained earlier. It's the removal of fluids from the peritoneum. Also, fluids are going to be ordered, so we need to keep that patient hydrated. We need to educate them about restricting alcohol use because the alcohol is what is actually causing the damage of the liver. So if you like my videos, make sure to subscribe and share. If you have any questions, leave a comment below. And if you want to follow along with this lecture, you can also go on Etsy.com and search Tribe Nursing, and you will find my handmade notes. And with that being said, thank you for watching and have a good one.